And joining me now to go in depth on this topic is the U.S. Senator from Wisconsin, Ron Johnson. Senator, it's great to have you with us.
Morning, John. How you doing?
I'm doing well today. Senator, of course, that second healthcare worker from Texas Health Presbyterian Hospital is now infected with Ebola. And yet again, CDC Director Thomas Frieden is saying, well, we could have done better. Is it time for Frieden now to step down?
I'm not so sure about that, but it's certainly time for us to totally review our procedures and our protocols and how we're handling this. And it's also time for the CDC and the public officials to be completely open with the American public and exactly what happened. You know, we still don't understand if there was a breakdown in protocols. What was it? How were these nurses gowned up? How seriously? Obviously they were taking it seriously, but we just simply don't know how they were infected, and that's some information we really ought to know.
From what you know at this point, though, who do you think is more responsible for these apparent breaches in protocol? The hospitals, which may have not provided enough training for its employees, or the CDC for not really getting the word out to these facilities in time and having a plan in place?
Well, I think the CDC has been offering some rather bland assurances, and as a result, even before we got this first case, they're always saying, "Oh, we're totally prepared for this," when obviously we weren't totally prepared for it. But what I really blame is the administration for not slapping some travel bans and really reviewing exactly what we're doing in terms of letting people into this country that have been in these disease-stricken nations. I don't think we should be letting people in, or if we do, we should certainly isolate them for 21 to 28 days and not let them roam around in the general public like Mr. Taylor was allowed to roam around.
Well, we can talk about the administration's response here in a second, but since you mentioned those travel bans, yesterday we had a discussion with Alan Dershowitz here, a noted civil libertarian, saying, look, if this administration can put travel bans in place against Israel after one small rocket attack there, why are they not imposing a travel ban now during an international health crisis?
I have no idea. It makes no sense to me. That's something we should do immediately. From my standpoint, we do need to do everything we can to contain the outbreak in West Africa, but the best way to prevent it from coming here is let's make sure that people that are in West Africa don't come into America, or let's face it, we're going to have people going back and forth in terms of the support and healthcare workers. When they've been in West Africa, they come back to America, we isolate them for 21 to 28 days. I think it's better to be safe than sorry at this point in time.
Yeah, better safe than sorry. And, to some folks, it might seem like a far-fetched idea here. And the Department of Homeland Security says there's no evidence right now of any Ebola threat directly linked to ISIS. But despite this, and as reported by Forbes, retired Captain, Navy Captain Al Shimkus, a professor at the U.S. Navy War College, said that ISIS militants may infect themselves with Ebola and fly to this country, thus using the disease as a biological weapon. How real is that threat to you?
Well, it's certainly something I've been thinking about ever since this Ebola outbreak started. And you really don't even want to think about it, don't even really want to talk about it, but we should do everything possible to defend ourselves against that possibility, because I think that is a real and present danger.
Well, another threat here that could be, if not connected directly, indirectly here, and this was actually discussed yesterday at the United Nations, the economic and political effects that this disease is having on some pretty fragile democracies over there in West Africa. Is the greater concern perhaps of what could actually come after the disease when you have a destabilization of some of these countries and then thus a power vacuum?
Oh, this disease is going to devastate those countries, those economies. Let's make sure it doesn't spread, because we're already seeing the economic impact even with a couple cases here in America. That's why I think it's important to take strong and resolute action, which is what we're not doing here in America yet.
And do you think if things get bad enough that the governments of Liberia, Sierra Leone, and the like could fall if they lose the trust of the public there?
I mean, again, I can't predict what's going to happen to the governments over in West Africa, but again, it does point to why I am supportive of this administration's efforts to send military construction crews to build the isolation units, and we should be supplying, or flying in and supplying all the types of gowns and gloves and everything they need to contain that disease in West Africa.
All right, Senator, we're going to ask you to stick around for a little bit longer. We do want to talk a little bit more about what's taking place in the Mideast. We'll turn our attention away from Ebola and talk a little bit more about ISIS and what the administration is doing and what Turkey is doing as well. We'll also be joined by General Michael Hayden for that discussion as well. America's Forum rolls on after this short commercial break.